So I'm going to enter the area and check that the area is safe, which it is. I'm then going to sanitize my hands. I'm going to check the expiry date on the bottle, which is fine. And I'm going to use the 7 steps of hand hygiene, which the World Health Organization recommend. So I've already introduced myself to the patient. I've checked that the patient has privacy, so the doors and windows are closed. I've asked the patient's preferred name. I've checked the ID using the 3-way ID check. I've checked the patient's allergy status. She's not allergic to anything. And I have also made sure that the patient is comfortable. So I'm then going to explain the procedure to the patient. Hi Sophie, I've been asked to come and just have a little chat with you because you're having some problems with your urination, is that right?
Yeah, that's right. I've got an ache in my lower abdomen and I feel like I really need the bathroom, but when I go there's not much to show and it really burns.
So it sounds as though you might have a urinary tract infection, but we won't know that for certain until we can test the microbes in your urine. So what I would want you to do is something called a midstream urine sample. Have you done one of those before?
I'm not sure, can you remind me?
Okay, so what I'm going to do is just give you a specimen bottle and some gauze. I want you to go to the bathroom, dampen the gauze and just give yourself a clean from front to back. Then I want you to start passing urine into the toilet. Pop the bottle in after a second just to catch the middle bit of your urine stream and try to sort of do about half of the bottle and then take that out, pop the lid on and just give the bottle a wipe around if any urine's on there. It's nothing to worry about. And then if you can bring that back to me, I can then test that for you. Are you happy to do that?
Yeah, that's fine.
Great. So I just need to get the equipment ready first. So I've got everything we need here. So I'm just going to give you the urine sample bottle. The top just screws on and off. I'm going to give you some gauze. Again, just to remind you just to dampen that and give yourself a clean from front to back. Before you start, if you can just wash your hands and then also obviously when you're finished as well. And then if you can just bring that back to me, the bathroom's just around the corner there. All right. So while the patient is in the bathroom, I'm just going to make sure I've got everything I need on the trolley. So I've got my disposable, non-sterile gloves, my apron, got my hand gel, my urinalysis sticks, I've got a clinical waste bag, I've got some gauze and I've got a disposable tray to put the urine sample in. I've also got my chart to document the results and made sure I've got a pen available for that as well. So the patient's back from the bathroom with the urine sample. I'm going to sanitize my hands first of all. I've already checked the expiry date on the hand gel. I'm going to then pop my apron on. And my gloves. Take the specimen and pop it inside the disposable tray in case of any spillages, and I'm going to open my clinical waste bag and pop that on the trolley. going to get some gauze out and pop that onto the trolley. And I'm going to open the urinalysis sticks, and I've already checked the expiry date on the sticks. I'll pop the lid back on there. Then I'm going to take the lid off the urine specimen, and I'm going to pop the sticks into there for no more than 1 second, making sure that is fully submerged in there. I'm going to just lift that out, keep it horizontal, make sure that there's any excess come off there. Then I'm going to pop that onto the gauze and put the lid back onto the bottle. I then need to time track the results. And the first result will be the glucose, and that is after 30 seconds. And the glucose is 1 positive. Then the next one, also after 30 seconds, is the bilirubin, which is negative. Then after 40 seconds, the ketones, and that one is negative. So then specific gravity after 45 seconds, and the result is 1.015. Then we have the blood after 60 seconds, and that one is negative. The pH, again after 60 seconds, and that one is 7. Protein after 60 seconds, and that one is negative. Nitrates, again after 60 seconds, and that one is positive. And then after 120 seconds, you check the leukocytes, and they are 3 positive. I will then dispose of that into the clinical waste bag. Remove my gloves, put them in the clinical waste bag, and also my apron. Again, that goes into the clinical waste bag. I will then sanitize my hands, and I've already checked the expiry date on the alcohol gel. I'm using the exact same technique as before. So I'm then going to document the results onto the chart. So that is glucose 1 positive, bilirubin negative, ketones negative, specific gravity 1.015, blood negative, pH 7, protein negative, nitrates positive, and leukocytes 3 positive. I will then make sure that the sample is labelled and pop that into plastic sealed bag, ready to go to the lab for further testing. Hi Sophie, I have taken a look at your urine sample there. It is quite cloudy. It does have quite a strong smell, which would indicate a urine infection. When I've used the dipstick, it has shown that there's quite a lot of leukocytes in there, and again that's indicative of a urine infection. So what I'm going to do is send that off to the lab for further analysis to find out which antibiotics would be the best to treat the infection. And also in the meantime, if I can just get you to drink plenty of fluids, continue to take painkillers as you need them, try and eat well and try and rest. And then as soon as we get that result back, we'll be able to get you some antibiotics prescribed. Is that all right?
Yeah, that's fine.
Is there anything else I can do for you before I leave?
No, that's all, thank you.
Okay, thank you.